Hello, everyone, and welcome to the St John of Jerusalem Eye Hospital Group CEO briefing webinar. Thank you so much for being here today. I can see that we've got a lot of people joining us from across the world, and we're very grateful that you've taken time out of your day to hear more about our vital work. So thank you so much for your support. I'm Julia Gilmore. I'm the Senior PR Officer for the St John of Jerusalem Eye Hospital Group, and I'm delighted to be joined today by our CEO, Dr. Ahmad live from Jerusalem, and the Executive Head of the UK office, Harriet Wheeler, here in London. So today we'll be talking about what the group achieved in 2025 and our plans for the future, including, of course, the ongoing situation in Gaza. So you can feel free to submit any questions you may have in the Q&A box, which should be somewhere at the bottom of your screen. We'll try and answer some of these as we go along, but we'll be dedicating around 10 minutes at the end of this session to talk about questions from the audience. So without further ado, I'm going to hand over to Dr. Marley for a short presentation. So over to you, Ahmad.
Well, good afternoon, good morning, good evening, depending where you're joining us from. And thank you, Julia, for the kind introduction. And thank you, Harriet, for organizing this briefing for our supporters and global partners. And thank you, our partners and supporters, for joining us for this session this afternoon. As Julie just mentioned in the first section of this briefing, I would like to spend about 20 minutes giving you an update on our services, our achievements, our challenges, especially in the last year, 2025, as well as the ongoing political security situation we are facing here in the Holy Land. So I'll try and share my screen now. I hope, Julia, you can see my screen.
Yep, I think it's just loading. There we go.
Excellent. So, as I said, I would like to say a few words about how we have sustained our eye care services in this conflict zone, especially over the past 2.5 years. Some of you know this already. Just a way of introduction, St. John Eye Hospital is the oldest eye hospital in the Middle East and was officially established in 1882 in Jerusalem. It was established to provide quality eye care services to the people of the Holy Land, regardless of their race, religion, social class, or ability to pay. Our aim has always been, and we have maintained our aim, which is about eliminating all causes of avoidable blindness and continue to lead ophthalmic service provisions in this region. Blindness in general and avoidable blindness, most of blindness can be avoided. Almost 80% of blindness can be avoided worldwide. Although we serve a relatively small number of population, if you like, residing in a small geography, this map shows the West Bank, East Jerusalem, as well as the Gaza Strip. Is kidney shaped, if you like, with the various governorates, districts. And basically, we started in the middle in Jerusalem, here in, as I said, in 1882. However, our patients have faced problems with access to eye care, and the hospital has made a decision early, about 10-15 years ago, that we needed to form a group in order to overcome issues related to access to quality eye care for our patients. So in 2010, we have become a group of hospitals providing services across the region. And what happened after that, we have become a group that has two arms, if you like. The first one is the Jerusalem Eye Hospital, and it also includes the Kfar Aqab Center and a small clinic in the old city of Jerusalem. This arm of the hospital group provides services mainly to people residing in the Jerusalem district and also patients who travel from the West Bank and previously from Gaza for tertiary eye care services as well. The second arm of the group, it includes the Gaza Hospital, which is here, and also it includes the Nablus Hospital, as well as the Hebron Hospital, in addition to the mobile outreach services. Now, the impact of the current war on our services in the region. The current Israel-Iran war, if you like, has been going on for almost 4 weeks now. I think it's a bit more than 4 weeks, and has impacted the safety as well as of the patients as well as the staff. Access to eye care since the start of the war has been severely disrupted due to safety concerns of our patients, of our staff, but also due to the heightened security measures imposed by the authorities. All staff have been instructed not to move, not to travel if they deem traveling or reaching the hospital or the satellite centers risky. So in order to minimize risk to our patients and our staff, we have taken a number of temporary operational measures, and these vary according to the situation and the security situation. So over the past few weeks, we have adjusted our operations and have canceled services that deemed risky, especially those that required our staff to travel from the main hospital in Jerusalem to the West Bank or vice versa. As a result, there has been a sharp decline in the number of patients treated, especially at the Jerusalem hospital over the past few weeks. In the West Bank, you may know, but there are no designated war shelters. However, the Jerusalem hospital is equipped with a shelter which both patients and staff use when rocket sirens are sounded. These vary, but unfortunately, they have become frequent now in Jerusalem, occurring between 5 to 10 times a day. If we go to Gaza, as you may be aware, but Gaza war started in October 2023. So for almost 36 months, there has been a conflict in Gaza. 24 months, there was active war with fierce fighting and active military operations. There was some ceasefire agreement reached in October of 2025. As a result of the war, our hospital was partially damaged, collaterally damaged, and we have unfortunately lost all our medical equipment and furniture. During the conflict, which is 24 months of conflict, our staff were displaced twice. And until now, many health facilities in Gaza remain non-functional, and the humanitarian crisis remains largely unsolved. So what has been our response in Gaza during the war until now? Safety of our staff has been our main concern and priority, and in order to minimize our risk to our staff, we worked with different international partners, including the WHO, to secure supplies, not only for our work, but also food supplies for our staff and their families. We have shared our locations with the concerned authorities to prevent harm occurring to our staff and patients. Even during the displacement of our staff, we established 4 medical stations to provide very much needed eye care to the displaced people and people of Gaza. We have also provided sight-saving treatments to those suffering from diabetic retinopathy, including intravitreal injections, as well as laser treatment. Following the cessation of all hostilities in Gaza, our staff managed to return to the hospital in Gaza City and commenced renovating the hospital, namely the outpatient department, the operating theaters, as well as the daycare unit. The hospital outpatient department is now fully functional, and only last week we've managed to perform our first surgical session on 3 patients. Our impact throughout the war until now, we have treated more than 100,000 patients, despite the scarcity of resources and the difficult working conditions. We have worked hard to secure and ensure the safety of our staff and patients as well as staff families as well. We have continued to work, we have continued to look after the welfare of our staff. Many of our staff were not able to travel to the hospital or travel to the sites to perform any duties. But despite that, we continued to look after them and pay their salaries. So that was our main objective, really, to look after the safety and the welfare of our staff. This chart really shows the needs of our patients we have seen in Gaza. And as you can see, almost 14% of our patients we have treated in Gaza are in need for site-saving eye surgery. Almost 4% of our patients we have treated so far are in need of site-saving treatment for diabetic retinopathy. That includes injections, Avastin injections, and laser treatment. 23% of our patients need simple eyeglasses. Our target now is to expand our surgical uptake in the next few weeks to perform complex retinal and pediatric surgery. The main obstacle remains to be the free flow of medical supplies essential to commence and sustain such a service. If we come back to the West Bank, since October 7, 2023, the authorities have imposed major movement restrictions. There are now more than 1,000 security checkpoints, as well as gates that separate the various parts of the West Bank. Many of our patients have not been able to reach us, especially the Jerusalem hospital, due to security concern as well as restriction on movement. In order to overcome the issue or the challenges that our patients face, we have decided to adopt a new philosophy of eye care, which is reaching out to those who cannot reach us. We were forced to undertake such measures in order to overcome access issues where patients struggle to reach our facilities, especially our facilities in Jerusalem. The dire economic situation preventing patients from using local private for-profit eye care services. The higher prevalence of causes of blindness, avoidable blindness, including cataract, diabetic retinopathy, as well as refractive errors. We have realized that there was an urgent need to address these causes of avoidable blindness and mitigate their social and economic impacts. Our approach, or this approach of taking services to people, we undertook various measures, such as we focused on those who are in most need and those who are at high risk of losing their sight. We targeted the most marginalized and those living in refugee camps. We focused on screening and early detection to prevent blindness. We worked with other partners to strengthen community-based services by decentralizing our service delivery. Some of our community-based services included and still include vision screening programs for children, neonatal eye screening, and diabetic retinopathy screening. We have screened the vision of more than 120,000 children over the past 2 years alone. Almost 12% of those were referred to our satellite centers and the Jerusalem hospital, either for eyeglasses or further treatment, including surgery as well. We have also conducted screening for infants in neonatal units and also screened for diabetic retinopathy. Diabetes is very prevalent in this country. It accounts for almost 15% of the general population, but more than 30% of people over the age of 40. Achievement to date of this new philosophy. Some very important milestones. We have established 5 service sites outside of the Jerusalem hospital. That includes the Kufr Aqab Center, just outside the separation wall, the Nablus Hospital, the Hebron Hospital, the Gaza Hospital, as well as the small clinic in the Muristan clinic, in small clinic, which is called the Muristan in the old city of Jerusalem. We have also established, you can see 3 cars on the map. These are our mobile outreach services. We have established 3 mobile outreach services in the West Bank to provide services to the north, middle, and south districts of the West Bank. We've also extended our outreach services to the refugee camps and displaced refugees in the Gaza Strip. One of the landmark achievements last year was the establishment of a surgical unit, or a surgical hospital, if you like, in Nablus, which caters for 6 districts in the north of the West Bank. Since it has become functional, the hospital treated more than 16,000 patients. We have also performed more than 260 site-saving surgery in the past few months alone, with a target to undertake 1,000 surgeries in 2026. It's important to note that almost 75% of our customers, our patients who receive service at the Nablus Hospital are refugees residing in a number of refugee camps in the northern districts. Another achievement has been the expansion of our Kufr Aqab Center. The center was established outside of the Jerusalem Separation War in 2022 to provide services to the people from the middle areas who are unable to reach us in Jerusalem. It now provides eye care services to more than 13,000 patients. As a result of this demand for service, the center has been expanded, renovated recently to accommodate the growing demand for eye care services in the region. So what has been the impact? We reached more patients than ever before. We improved patient compliance with treatment protocols by enhancing access to eye care services. We have been providing eye care services closer to our communities. Patients have timely access to eye care, and as a result, we have prevented the visual impairment and also blindness amongst many of our population and patients. On the outreach front, if you like, and which is part of our community-based services, our mobile outreach teams treated last year more than 27,000 patients. Of those, 1,500 were referred for site-saving surgery at our satellite centers, as well as the Jerusalem Hospital. It's worth noting that this service is provided to the most marginalized communities, and it is totally free of charge. This map, again, you have seen it before, but this map with numbers shows our 6 sites, the 2 arms, if you remember, of the group. The 3 service sites in Jerusalem, as I said, the Jerusalem Hospital, the Muristan Clinic, and the Kufr Aqab. These 3 sites treated last year 70,000 patients. The other arm of the group, which is the Nablus Hospital, the Gaza Hospital, and the Hebron Hospital, at that group, we treated more than 161,000 patients. Altogether, we treated more than 231,000 patients. This is a new record for the hospital, and our target this year, in 2026, that we need to reach 250,000 outpatient visits. These 2 graphs emphasize the demand and the need for eye care services. And the one on the right shows our outpatient activities in the last 10 years. And you can see that almost 1.5 million outpatient visits have been conducted, or treatments have been conducted over the past 10 years. As for surgery, around 60,000 major site-saving surgeries were performed. And you can see the drop in the surgical activities over the past 10 years, especially during 23-24. The main reason for this, or the only reason for this, is that we have lost our surgical facilities in Gaza during the war. Now, with the establishment of surgery in Gaza, we hope these figures again will go up again in the year 2026. I'm about to finish. Just thought to mention to you one or two of our strategic projects for 2026. We plan to strengthen our services in Hebron by establishing pediatric eye care services and enhancing access to eye care in Hebron. Currently, we don't perform pediatric surgery in Hebron, so we will definitely establish a pediatric surgical walk in Hebron in 2026. We also plan to establish a commercial pharmacy in Jerusalem to serve our patients and also generate income to support our charitable work. We plan to install solar panels in Jerusalem to reduce cost, but also enhance the efficiency of the group. Finally, I'd just like to say that thanks to the unwavering support of our global partners, donors, and supporters, we continue to save sight and transform the lives of countless underprivileged patients in the Holy Land. Thank you so much indeed for attending this session. Thank you. Over to you, Harriet.
That's right. Hopefully everybody can hear me. Just before we get into the main Q&A session, I wanted to ask Dr. Mali a couple of questions. First of all, thank him for such an enlightening talk, as always. You talked, about patient numbers and mentioned lots of records. Last year over 232,000 patients reached, and we're anticipating over 250,000 this year as well. I mean, these are phenomenal numbers that we're talking. How do we, bear in mind, quality is at the very heart of our mission and providing our patients with expert quality care, free to all, to those who can't afford to pay. How do we expect to balance the increase in demand for the services with the sort of pressure on the resources and maintaining a high clinical quality at our centres?
Well, thank you very much indeed. This is a very good question, and that's a question every manager, CEO, leader is asked about how you balance out the volume of work with the quality services. I would just like to say that we have become a quality hospital. We were the first hospital in Jerusalem to receive the Joint Commission International accreditation in 2013, yes. And quality has become part of our service delivery. Recently, on the last year, also we managed to get our Hebron Hospital accredited. Joint Commission International, it's an accreditation body, an American accreditation body that gives certificates, if you like, for international hospitals, clinics, and it has very strict, rigorous standards for patient safety and quality across the hospitals and the clinics in around 100 countries in the world. Now, we've received this last year, and this is not granted forever. We received this based on rigorous inspection that lasts for about a week, and therefore, I am comfortable to say this has become, quality care has become, and patient safety has become an integral part of our service delivery. The expected increase in the number of patients, of course, that's important, and that is really a signal, if you like, for everybody that the demand for eye care services is high. But of course, as managers and leaders, we need to review our staffing levels based on the demand for services and as well as the volume of the work we do. Training our staff, we are a teaching hospital, so that is an ongoing process. But also, most importantly, every manager should also monitor the service and its quality. And we take this again seriously, auditing our services, listening to our patients, listening to our staff. So I think balancing the quality with the volume of work we're going to do, it is not a problem. I don't think it's going to be a problem. But of course, it comes with a lot of planning as well as monitoring. Thank you.
Brilliant. Thank you very much. The other thing you touched upon was staff and people, and obviously that's such the most important aspect of what we do. In such challenging circumstances, I mean, how do you, as a CEO, how does the board of trustees, the senior management team, how do we sort of keep the staff going? How do you keep morale up? How do you keep people coming to work every day, for the large part with smiles on their faces? I mean, these are really sort of difficult circumstances in which people are working. in Jerusalem and the West Bank, let alone in Gaza. So how do you as a CEO, we as a group, how do we manage all of that?
Yeah, it's not easy. It's not easy when staff struggle to reach the hospital based on the security situation. It's quite sometimes it takes them hours to reach the hospital, and the other days they are able to reach with no difficulties. So when they arrive, we really don't make a big issue of them being late. We understand this, so we take care of that as well. But if you like, at the macro level, the board has been extremely supportive. The board of trustees has been extremely supportive. We have been looking after our staff. We're paying our staff on time. There are a number of benefits that we have included, such as our people in Gaza. One example for our people in Gaza, we have worked with international agencies to secure food supplies to our staff and their families. That was very important for them, and that was really that made them feel valued and appreciated. But also at the practical level, our staff really face a lot of stress, and we have in the last few months introduced mental health training to give staff resilience, what we call mental health first aid sessions. Actually, today I think there was one of the sessions taking place, and therefore we train our staff, especially in Gaza, to be able to provide support to each other. And of course, empowering the staff and valuing their work is very important. These are difficult times. There is no magic solution, but leading from the front, thanking the staff, we're empathizing with their struggle, if you like, to come to work. And that these are they are minor things, but they make a lot of difference.
That's right. I wonder if now's a good moment as well to maybe just briefly talk about, for those that don't know, and there will be there's a mix of people on the call this evening. There's some that know us very well, and there's others that are new to sort of St. John and to the hospital. Whether it's now's the moment to sort of talk about the structure of it and how it's governed. And, we have a board of trustees, a senior management team, and maybe go into a little bit of detail so people can start to sort of imagine it in their head.
Yes, absolutely. I mean, as I said, we've grown a lot in the last, based on the demand. I'll give you a background to this. We were born in Jerusalem, and I have been part of this great organization for many years, I would say 30 plus years. And many hospitals in Jerusalem are now struggling because they didn't have the vision to reach out to their patients. There are 6 hospitals in Jerusalem, and we were the only one who had the vision to reach out to patients. Therefore, we established this group, and I said the 2 arms of the group. So we very much function. I mean, our governance is that we have the board of trustees. It's an international board of trustees. We have a chairman. We have a hospitaler. There are 12 members who are providing governance. We call them board trustees. I report to the board of trustees. Of course, under that, I have also a very capable team of 7 senior leadership teams, including yourself, Harriet. And each one of them is responsible not only for the Jerusalem hospital, but also responsible for for example, the medical director is responsible for medical services in Jerusalem, but also in Hebron. But in order to ensure that the work is, the hospitals, if you like, the satellite centers function smoothly, each center or each hospital does have its own leadership team as well. So in Hebron, we have a medical lead, we have a nursing lead, we have a financial lead as well. So these people have independence in many ways of their work, but they report to Jerusalem for strategic issues. But we have adopted the decentralization of management, and therefore these people these staff members are both capable and also responsible for running the service. So basically, I'm the first CEO who is homegrown, and previous to that, this hospital was run by an expatriate CEO, and also some senior leaders in the hospital were expatriate. But now we have trained our local people to undertake these very critical and important roles. So the hospital is governed, as I said, with the board of trustees being international. Some of them are American, some of them are British, but I report to them, and the hospital leadership team look after the hospital. So operationally, we have the authority and to run the hospital or the hospital group, but we, of course, we report to the board of directors. So that is the way it's working. Altogether, we have 283 members of staff. All of them are homegrown. I would say all nurses working at the hospital have trained at the hospital, and almost 90% of the doctors who work at the hospital have trained at the hospital. So we are unique in many ways because we produce our own people, and therefore people ask me sometimes, what about retention of staff? We don't have a problem with retention. Believe me, some of our staff stay with us 43 years, 40 years. The average stay of our staff they work with us about 25 to 30 years. So I feel that's a very unique setup. It has a Palestinian touch or a local touch, but also it's very much influenced by Western culture of practice, both medical and work as well.
Thank you. That's very informative. Just a couple more questions from me, and then we'll go to the sort of main Q&A. The strategic plan that we've initiated for the next couple of years talks a lot about our building in Jerusalem, which is 65 years old, and we have big plans, do we not, to renovate it? So I thought it'd be great to hear a little bit about that, what the plans are, because many of the people here, I think, this evening will have actually visited Jerusalem.
Yes, indeed. I'm sure some of our friends on this call, if you like, on the screen, have visited the hospital, and they know the layout of the hospital. Yes, this hospital was built in the 60s. It's a beautiful building, and it was fit for purpose at the time. Things have changed since then. It's a bit tired from inside, but that's not an issue. We can always renovate, but things have changed. The needs of the hospital have changed. I remember when I first joined the hospital, we had 84 beds, and trust me, the beds were full 24/7. Now, we don't have that number of beds, but we still have inpatient departments, and these are really not needed. Most of it not needed, and therefore, with the advancement of technology and the advancement of healthcare, if you like, especially ophthalmology, the focus now is more on daycare services, more diagnostics, and therefore the need for the hospital now has shifted from inpatient to outpatient services. And also the advancement has meant that we need to focus more on research, innovation, AI, and other sort of advancement in the field. What we were planning to do now is we're planning to look at the building, have a number of brainstorming sessions with the staff and the board to visualize what are the needs of the hospital, not only now, because we know what the hospital needs are now, but what is the need of the hospital in the next 10 to 15 years. And that we call it the master plan. And this master plan hopefully will be produced this year, and it shows every department or the need in each department, and hopefully it achieves our vision and our aim. But we are a hospital. We need to do this in a phased way. So I expect this to take about 3 to 5 years because we cannot be remodeling, restructuring, refurbishing, if you like, the whole hospital at a time or at once. And therefore, this will be a phased project. We might start with inpatient care, maybe go to outpatient later on. But that is really the idea. Again, the facade of the hospital we will maintain, and the hospital is a beautiful building. But from inside, I think it is a bit tired, but also it is no longer fit for the advancement we have witnessed over the past few years in medicine, especially in ophthalmology. Thank you.
That's great. Thank you very much. I can see we've got lots of questions coming through on the Q&A, so I'm going to hand over to the audience now. So Julia,
Sure.
my colleague Julia is going to handle this part. And I'm
Hello,
gonna...
thanks for that, Harriet. Yeah, we've got some great questions coming in, and you can keep them coming. We'll try and answer as many as possible. So I'm just going to pick one at random to start with. So someone has asked, in the disturbed/disrupted conditions of the West Bank, how are the mobile outreach services organised so that the population is aware of them?
Yes, I mean, that's a very good question. The mobile outreach services, as I said, there are three of them. And we are very experienced because the service has been running since 1980. And therefore, we have excellent relationship with the community leaders. We have a monthly program which is circulated to all our community, the beneficiaries in our communities. And everybody will know when we are arriving at their location. I'll give you an example. I ran outreach before. Sometimes you go to a village, you're due to be at a village, but the village leader, if you like, or the focal person has forgotten to inform. Doesn't happen often, maybe once every 6 months, has forgotten to tell people that St. John of Jerusalem is coming. What you need to do is just go to the mosque and announce that St. John of Jerusalem is here. And believe me, that will be your worst nightmare because there will be 200 patients coming to see you at once. So there is no problem there. We have integrated the service within the community, and we work closely with village leaders, and they respect us, and they value the service as well. Every time we go there with the board to visit, they always offer to give us a land so that we can build a hospital there. I promise you that much. And some of our board members get excited, say, "Oh, that would be a good offer." I said, "Come on, no, we can't have a hospital in every place." But yeah, I would like also to say that because of our existence since 1882, there isn't one single family in this country that has not come either directly or indirectly with the eye hospital. So in many ways, we enjoy good reputation, and as a charitable provider, we are valued by our beneficiaries and our patients.
Great, thank you. Another question, are you consulted at all by the government or by peacekeepers on the state of civilians in the West Bank and Gaza?
We try to keep away from that, I must say. But if we are consulted, we will answer questions related to eye care services, rather than the political situation on the ground. I mean, anybody can go to the internet and find out what's going on in Gaza. For us, really, the main focus is on our patients, our staff, and the delivery of eye care services. I must say, I have not been asked officially from governments about the situation in Gaza. But yes, they usually ask about our services in Gaza, service delivery, and what are the challenges we face in Gaza when delivering eye care services.
Thank you. I've got another question about outreach here. So, of patients referred from outreach and child screening, what is the follow through for attendance of referrals? And what challenges do you face in patient adherence to referrals and how they can access further care?
That's a very good question. I always have fights with my with my managers about this because it's very important to know what is the compliance rate. I would say sometimes it's difficult with child vision screening to get an accurate record or percentage of compliance because we go and screen the vision of children, and therefore sometimes it's preschool, sometimes it's school level, and we tell them your child has a refractive error and needs eyeglasses. Because we don't provide eyeglasses at the hospital, these patients or the relatives might take the patients elsewhere to purchase the eyeglasses for them. But those who come to our hospital who need services like surgery or diagnostic procedures, I would say the compliance is not less than 50%. Now, for surgery, for the outreach, it's almost 81% of patients who, but we now establish another system whereby we call patients. We call patients to why didn't, if they fail to attend, we call them. And sometimes, because, for example, if a surgery is only performed in Jerusalem, and because of the difficulties of the security challenges they face, especially if they are elderly, they might opt for a local provider rather than a Jerusalem hospital. Because we don't provide all services in Hebron, we don't provide all services in Nablus. We aim to enhance this, as I said, about pediatric services in Hebron and maybe retinal services in Nablus. So it's about 81%, the follow up, the attendance rate for surgery from the outreach, yes.
Great, thank you. And just going back to those access issues, someone's also asked, how do you see new technologies or even AI helping patients access care, given the kind of extraordinary access issues patients are facing, particularly in light of the recent outbreak of war?
Well, I think AI is here to stay, and I think we can use AI, and because we believe in AI and we believe in technology, we have sent one of our doctors. He's now in the United States undertaking a 2-year master's degree in health informatics and ophthalmic AI. He'll be back in June. And when I went to the States, I visited him at the university and he showed me some very important, and I think one of the machines that he's working on is to do with diabetic retinopathy. And I think we can use that. I think a day will come, maybe it's not my time, but a day will come when we will need less qualified doctors to do surgery, because the way things going with AI, I think is going to, we need to use AI a lot, and especially in isolated communities. I'll give you an example. This machine I have seen with when I visited in the States, you take this small machine and you go to a village and you screen for diabetic retinopathy. You don't need to be a doctor, you don't need to be a nurse, you just need to be somebody who can walk the machine, and the machine tells you exactly what is the level of damage at the back of the eye, and what is the treatment plan. And I think that is really what we need here, because it's about, efficient using resources more efficiently, but also reaching out to everybody. Because if we send a team to screen in a village, they will see 70, 80 patients. There will be a team of 5 or 6, including a doctor, a nurse practitioner. But if you send one technician with this machine, he will be able to see between 100 and 150 diabetic patients. And therefore, these are the areas we need to look at to ensure that we enhance access to eye care. And also, diabetes, as I said, is very prevalent. And therefore, many of our patients, unfortunately, reach us at a late stage when they require vitreal surgery, with, unfortunately, the outcome of which is not always brilliant, especially if it's advanced disease. So yes, AI is here to stay, and we are definitely planning to use AI to enhance access, coverage, as well as efficiency.
Thank you. And you've sort of touched on this in your last answer. Someone's asked, with all of the staff being homegrown, how do you stay abreast of new technology and new training? Have you considered having a few spots open to rotating professionals from outside the team or outside the country?
Absolutely, absolutely. As an ophthalmic hospital, ophthalmology, and we are the only, well, maybe in Jerusalem, we are the only eye hospital. This is a profession that you feel isolated, because everybody's talking about hearts and kidneys and all of that, and you can find so many people who've got the same common language. But for us, really, it's about eyes. They are all homegrown. It's a challenge to keep people updated, I must say. But yes, the advice is being taken, and we have a number of doctors and healthcare professionals who visit us frequently, including, for example, 3 doctors who are really, they're not only doctors, but 3 professors of ophthalmology who are on the board of St. John. So we have a professor from America, we have a professor from England, and of course, the hospitaler also is a professor. So these 3 professionals, if you like, are here one of their main role is really to ensure that the hospital is kept up to date and our doctors are kept sort of informed. We encourage doctors, and even we take care of their study leaves. We encourage doctors to travel. We give our doctors, I think, about 7 days a year to travel and present at conferences. So we do a lot in this regard. Having said that, because of the security political situation and the restrictions on travel, things are not as planned, taking place as planned, because it is quite difficult for people to travel. And also, I forgot to say that one of our leaders or trustees is Chief Nursing Officer in London as well, so that she takes care of ensuring that our nursing allied health professions are really kept up to date as well. Yeah.
Fantastic. And this is kind of on the same vein of staff and training. So someone's asked, are all your staff trained within the St John Eye Hospital system, or do they gain qualifications elsewhere and apply to you at specific grades, any apprenticeships, etc.?
I would say all our nurses, because all our nurses have trained at the hospital. The reason why I say this, because we are the only provider of ophthalmic training for nurses I think in the country, if not in the region. So we have copied the Moorfields style, if you like, and we established a school of nursing that provides postgraduate diploma in ophthalmic nursing. So we are the only provider of this service in the region, as far as I know, and therefore definitely 100% of our nurses have come through the doors of the School of Nursing. So that's 100%. Now with doctors, slightly different, because we are the main teaching hospital for doctors in the field of ophthalmology. At the moment, we have 8 doctors training. Some of our doctors, I would say the majority, about 70+%, are homegrown from the hospital. Others come from outside, who, for example, people train in the country, but people train in Jordan, people train elsewhere, and join us at different grade as well. So recently, we've employed a doctor who trained in Jordan, and he is the medical lead in Nablus. But he didn't train at the hospital. But he needs to meet the standards of the St. John of Jerusalem Eye Hospital.
Great, thank you. I'm just going to ask a few questions that we've received about Gaza now. So someone's asked, are you receiving adequate medical supplies at the Gaza hospital and to run outreach?
We are not receiving enough. Basically, we have worked with the WHO, with Israeli authorities, to ship supplies to Gaza. We have managed to send some equipment, some medical supplies over the past 2 years since the war started, 2.5 years, but not at the level and at the rate we would like to do so. I mean, maybe in my presentation, I alluded to that we're doing surgery now in Gaza, but in order to move to a higher level of complexity, which is the retinal surgery, we need more medical supplies. Our application, if you like, or our request, that's the right phrase, to ship equipment and medical disposable is with authorities, and we hope that it will be granted. But what is surprising to me and maybe to you is that we have managed to get some medical supplies from within Gaza, and therefore we have been able to do the work there. Yes, it is not a free access to Gaza, and therefore everything has to go through security checks, etc. We managed to get some supplies in, but we would like to be able to do a lot more in order to meet the demand, the huge demand. If you think about Gaza, 70% of Gaza apparently is building have been partially or completely destroyed, including hospitals. And therefore we are operating at an emergency kind of level, because this is backlog. If you think about before the war, we treated 45,000 patients and we operated on around 3,000 patients. We have lost these over the last 2 years because we have not been able to do much surgery. And therefore there's a huge backlog of cases. Some of them are at risk of losing their sight. So this, we need to work once Gaza stabilizes, and I hope this happens soon. We need to work 24/7. We cannot really have a morning surgical session and we think this is enough. We need to work 2-3 sessions a day to be able to meet the demand for eye care services. And many of the eye care services in Gaza are not functional. we maybe one or two are partially functioning. So more supplies to Gaza is highly needed. We're working through the right channels with the WHO, with the authorities to ensure a regular supply of really highly critically needed equipment and supplies.
Right.
Yeah.
Going back to that high demand in Gaza, someone else has asked what plans are in place to upskill the local Gazan team who to deliver on the great demand in such a complex area.
What plans? We have plans on paper. Yes, I mean this was one of the topics I have discussed with our board. Our staff in Gaza are very tired. They've been going through a lot. They have been very resilient, and this sometimes surprised me that they have been able to provide the service. We need to have access to Gaza. We need to have access to Gaza to send them the needed help, if you like, with the hospital and with the trustees who are medical trustees. We have plans to send medical missions, if you like, or doctors and nurses from around the globe, mainly from the St. John Order of St. John, from the priories, to send people. And I promise you, people are lining up for that. So doctors who are at a high ranking kind of expertise are willing to go to Gaza and give training and support and take over some of the burden from our staff. All of this is on paper, but again, it all will depend on the security, political situation in Gaza. There is peace council in Gaza. Hopefully, when this war finishes in the Gulf, hopefully people will pay some more attention to the situation in Gaza, and we will be able to send help, highly needed help for our, not patients only, but also the staff. The staff in Gaza will definitely need a lot of support and upskilling, as well as support from their colleagues from all over the world and also from Jerusalem. I mean, I asked some of our staff who would like to go to Gaza when it opens. Believe me, all the doctors said they will go to Gaza and they will walk for weeks rather than for days. So we have plans, but our plans are really dependent on the development of the political security situation in Gaza. Thank you.
Great. Another question. How has the emergency affected the income we used to receive from the Palestinian Authority, for example?
Before the war, all our operations at the group made about 42% of the operational cost of the hospital, and you guys needed to bring 58% for the operations. Since the war of Gaza started, and since this war started, if you look at our accounts and figures for 2025, 34% of our operational budget has come from patient services. That includes the Palestinian Authority, that includes the Israeli Ministry of Health, because of course we work with the Israeli Ministry of Health and we look after their patients. And some patients, not very many, some patients are able to contribute to the service fees out of pocket. But this only makes 34% of the operational budget of the hospital. And it's not a huge budget. It's about $15 million to do all of this work, if you think about it. So with regard to the Palestinian Authority, I think they're struggling and they will continue to struggle financially. But they are bailed out every now and then by the European Union and also by the US administration, where they pay East Jerusalem Hospital some of the PA debt to us. Not all of it, some of it. And that keeps us going as well.
Yeah, and in this kind of same vein, you've sort of touched on this, someone's also asked, has the hospital group been directly affected by cuts to US aid and other aid from the US government?
Of course we have. We were one of the USAID favorite kind of hospitals. We used to get minimum of 500,000 to $1 million every year from the USAID in various projects. Unfortunately, with these cuts now, yes, we have suffered in the last year or so. The one simple project that's still going on with the old USAID, now it's called the State Department kind of wing of it. It's about advancement of staff training, which has been ongoing, but this is really a very small grant that we still are able to use, which is about staff training and upskilling. But yes, we unfortunately we have suffered from that. One thing the USAID used to do, which was very important, is pay East Jerusalem Hospital about $20 million, which is again to cover for the Palestinian Authority debts to Jerusalem, and this has stopped. So that really was a very important kind of element of our cash flow. We expected this to come every year, but unfortunately, we have not received it last time.
Thank you. We're nearing the end of our session now, so I've probably got time for one more question, which might be one that I can also refer over to Harriet. So someone's asked, aside from fundraising, what would you suggest is the best thing that a regular St John volunteer in the UK could do to support the eye hospitals, and what can Priories do? And this probably also applies for kind of our global St John family as well.
Harriet, or shall I? I'll go with the Priories.
You take the Priories.
Yeah, our Priories are fantastic, I must say. Our Priories, I mean, we couldn't have really survived without the fantastic support from Priories. I don't want to mention any Priory and forget the others, but all Priories have been extremely supportive financially, morally, and otherwise. So almost 1/3 of our voluntary income we receive from our Priories. So we're very grateful, and this is an opportunity to say thank you to everybody at the Priories for their ongoing support. Some Priories could do more, of course, but this is not the place to talk about that. But yes, I mean, it's not only about money; it's spreading the word. I think it's participating in these kind of meetings and being ambassador for the eye hospital. That's also very important for us, and I think we need to do more in also marketing ourselves, talking about our achievements and our work. We are all guilty of not doing enough of this, but I think all our supporters around the world would like to know more about what's happening in Jerusalem, and I think they can do more. It's not only about money and fundraising, but if I receive a letter from the Lord Prior, which I have received so many times, to say, Ahmad, we're thinking about you. We're praying for peace in the Middle East. We're behind you 100%. That's much better than $1 million. Believe me, when I send that message to the staff. So we very much appreciate. We're most grateful to the Priories and to the Lord Prior and to the Order of St. John for the ongoing support. After all, the St. John of Jerusalem Eye Hospital, the Order of St. John started here in Jerusalem, and then it's branched out to other Priories. But it all started here. The good thing started here in Jerusalem, and this is even the Order of St. John is called the St. John of Jerusalem, the St. John of Jerusalem Eye Hospital, Order of the St. John of Jerusalem Eye Hospital. So it's all started here, and I think our Priories are being fantastic. Some have faced difficulties, others have not, but everybody's been fantastic, and I couldn't say anything except thank you to everyone.
Great. Harriet, anything to add?
I think that was a great summary from Dr. Marley. I think the thing I can add is that we have a team here in London. As the CEO said, it's not all about fundraising, but we can't get away from the fact that about 60% of our income does come from fundraising. So it's absolutely it's fundamental to everything that we do. But equally, the raising awareness aspect is of vital importance, and that's where we hope to do. This is where this webinar comes in, and we hope to do more of these. And this is a first endeavour, I think, since for at least for a few years anyway. So, if you have any, we'd love to hear from you. So our faces now. We've got myself and Julia in London. We've got a small team in London. So we will be contacting everybody after this webinar, and so with our contact details. If you have there's some great questions asked. If you have any further questions that we haven't been able to answer today, do feel free to contact us, and we're always available to provide information about the hospital, whether you're giving a talk. We have the other thing I wanted to say is we have a new website as well, which has lots of information on it. It has lots of patient case studies. It has lots of ideas for fundraising. It has all details of events that we've got coming up this year. So the Guild of St John Eye Hospital is our group of female volunteers who've been fundraising for 100 years and raising awareness of the hospital for 100 years. They have a great lineup of events this year. So if you want to come along to something, to participate in something, then go onto the website and check it out.
Great.
Yeah.
I think that's all we've got time for today, but thank you so much, Ahmad, for joining us today. I know it's been,
Thank you, Julia and Harriet, and thank you for everybody who's joined us. And it has been great pleasure for me to talk about the work of the eye hospital. As you can see, I hope you have seen that I speak with passion because I was a young boy when I joined the hospital many years ago. I wasn't the CEO then, but it's a great hospital, has done a lot of good for the people, the most needy, most marginalized people in the world. And we have maintained this with given this service with dignity. We have maintained our apolitical, irreligious, if you like, kind of status. And I'm very proud to be part of this great organization and the Order of St. John as well. So thank you, Harriet. Thank you also, Julia. And for our friends and supporters, there will be peace in Jerusalem, I promise you. When peace prevails and you come to Jerusalem, you don't need to speak to anybody, just knock on the doors. I'd be most delighted to see you, give you a cup of coffee, and show you around the hospital. And once you see this hospital, you know what we're talking about and the great work that this hospital and the group has done for these most disadvantaged people in the region. So thank you again, and I hope to see you.
Yeah.
Thank you.
Thank you.